Hello, how are you today?
Hi, we're good.
That's good. My name is John. It's nice to meet you. And what's your name?
Mrs. Dean.
Mrs. Din? Nice to meet you.
Nika.
Nice to meet you, Nika. What's your date of birth, Nika?
February 14, 2010.
Perfect. Okay, so I have a referral for you for allergy testing. So this
Thank
came
you.
from your doctor. I also brought some paper in case you wanted to take some notes. There's going to be a lot of information shared here.
Yes.
So I'd like to make sure that you have everything possible to help you with resources and so on and so forth.
Yes.
Okay, Nika, how are you feeling today?
I'm good now compared to a few days ago.
Oh, can you tell me what happened a few days ago?
Well, my friend had a sleepover in my house, and then she gave me a food, but it says it's peanut free. But then after minutes, I started getting difficulty breathing, itching on my body, and then swollen face.
Yeah. I see. Sometimes packaging can be very deceiving, right? To manage food allergies, before buying the product, I need you both to actually be fully involved in this. So we use what's called the triple check. So, yeah, the first step would be to look over the ingredients that's on the nutrition label. And that's your first step in ensuring that you're not bringing anything home that you're allergic to. Also, when you get home and you're sorting through the groceries and putting everything away, double check at that point the ingredients. And then, of course, when you're going to prepare the food, also make sure that you're going over it just to make sure that you've taken all three steps in ensuring that you aren't going to be back in this position again. So, do you know what it says on your paperwork here? So that it definitely was an anaphylactic reaction that you had. Do you know what an anaphylactic reaction is?
Well, it occurs with the food that I ate, which was food with peanut on it.
Yes, that's true. Okay. So, do you know any other information about it, Mom? Do you know anything about anaphylaxis?
I do know that she gets it from the food.
Right.
So, but you told us, maybe it could be from anything, but she get it from peanut.
Yes. So in your case, it was from a peanut, but you could get it from an injection, from a drug that you're allergic to, or a bee sting, or from foods, different foods. Over and above that, I need you to understand have a complete understanding of the signs and symptoms that are involved,
Okay.
and how to prevent and treat them. So we've already discussed how to prevent them in one aspect, and that's with the triple check with your foods. Okay, so now how to treat them, that's going to be our next step. So also in prevention, you want to make sure that there's no chance of any cross-contamination. So that's when mom's making the food or anyone's making the food at home, making sure that there's no peanut. In your case, it's because it's peanuts. There's no peanuts being prepared at the exact same time. That's also when you go into restaurants as well. So you're going to have to ensure that the chef is not preparing.
Yeah, they're aware, of course.
Definitely.
I will
Okay.
make note of that.
Perfect. So other than that, the other thing I need you to be aware of is the different food allergies you could have. So basically, there's what we call a priority food allergens, which are associated with 90% of allergic reactions. So there's certain foods like shellfish or egg or milk, mustard, peanut, sesame, soy, tree nuts, fish, and of course shellfish. So until you get your allergy testing done, I would try to avoid these other foods. It's as I said, it's 90%. It's extremely high. So there's your pamphlet for you to take home.
Thank you very much.
And keep you well aware of everything. You're very welcome. So during a reaction, the most immediate medication that we would use is epinephrine. So your doctor has actually prescribed you your own EpiPen. So this is your EpiPen. So as you can see, it's blue on one side, orange on the other.
Yeah.
So this is a metered dose, so it goes by your height and weight specifically. So please, Mom, make sure that it's only Nika that's using this. It's prescribed to Nika, and it's not to be used on anybody else. If someone had a heart condition and they went to use this, it could kill them. Epinephrine could very well kill them.
I'll definitely make sure of that it's only for her.
Definitely. Okay, so I have a video for you to watch. Would you like to take a look and see how to use the EpiPen?
Yes.
Great, let's take a look.
Video will show you how to use an EpiPen. First, take the EpiPen out of the carrier tube. Hold the EpiPen in your fist with the orange end facing down. Do not put your thumb over the end. Remove the blue safety release with your free hand. You can give the shot through clothing or directly into the skin. Place the EpiPen against the outer middle thigh and push the orange end into the thigh until it clicks. Hold it in place for 3 seconds. Call 911 so you can be taken to the emergency department by ambulance for follow-up care. Use a second EpiPen if the symptoms are not better within 5 minutes.
Oh, what a great video, Nurse John. That's very helpful.
Yeah, it was easy to follow as well.
I'm glad to hear that. On that note, could I actually get you to show us and demonstrate exactly what we just learned in the video?
Yeah.
Perfect, thank you.
So I remembered that blue to the sky, orange to the mid outer thigh, and then I would hear a click, count for 3 seconds slowly, and inject it. And then if I get another allergy reaction within 5 minutes, I could get another EpiPen injected to my thigh and then call 911.
Yes, definitely. And just making sure that you're always going, if you're having a severe anaphylactic reaction like you had before, those signs and symptoms, you need to call 911 and you need to get to emerge.
Okay, yeah.
Do you have any other questions?
I think you provided us with everything. You also gave us a lot of pamphlets to take home.
Definitely.
And I also take some notes like you told me, and that's also great. And I believe we have everything.
Perfect. Well, lastly, here's another resource for you.
Oh,
so
perfect.
These are some more resources that are in the area.
Yes.
And this is a step-by-step of how to use your EpiPen. That way you can actually look over it whenever you get the chance at home. Our phone number is also written right here. Please don't hesitate if you have any questions to call us. We will do a follow-up phone call to you in 1 week to 2 weeks. All right?
Okay, thank you.
Thank you very much, Nurse John.
Nice to meet you.
I can keep this, right?
That is yours.
Okay.
Okay, I
thank
hope
you.
to never see you again here for anaphylaxis.
Yes,
Hopefully.
very much so.
All right, take care.
Take care.
Bye now.
Bye.